Assalamu alaikum. My name is Gayle, and I am a therapist, and I'm here with the International Medical Crisis Response Alliance, and I wanted to talk about trauma and its effects and possible treatments. One of the symptoms of trauma in adults is their hypervigilance. There's a type of numbing that happens. There's also separation from themselves and others, as well as a hypervigilance that occurs. Typically, treatment for these types of symptoms have to do with EMDR, which is an emotional desensitization response, cognitive behavioral therapy, dialectical behavioral therapy, as well as some medications depending on the severity of the trauma. Most adults respond very well to different medications, and the DBT, CBT, and EMDR treatment has been most effective. Best way to treat these folks is to meet them where they're at. Some adults want to talk about their trauma. Some adults don't want to talk about their trauma because it's just too painful. And I find that taking a very simple approach, creating an environment where, there's safety, and joining with the client has been the most effective way of getting them to open up, allowing them to trust, and to work through their pain so that they can cope and lead or move towards leading productive lives. One major factor to note is that trauma is different across developmental stages. Children from about birth to 5 have difficulty expressing their trauma, and the way they express their trauma is through crying. There's a type of clinginess or holding on to mom. There's a reversion back to bedwetting. There's nail biting. There's sometimes inappropriate behavior with their peer groups, and they have a hard time sleeping, being afraid of the dark and that sort of thing. Now, the next age group from 6 to 11, these children have about a 3 times greater risk of experiencing PTSD because they were at a younger age to experience the trauma. Their symptoms include anxiety, depression. There is also physical symptoms of headache. There is vomiting. There is stomach aches. These are some of the symptoms that the 6 to 11-year-olds experience. Then you have the adolescents, which they experience trauma a little longer. There's a feeling of hopelessness, helplessness. There's also the case where substance abuse comes into play. There's thoughts of suicide. There's acting out behaviors. There's teen pregnancy, and just an inability to cope and to trust because they don't believe in tomorrow because of their trauma. And they are a very risky group that you really have to keep your eye on. But overall, what all of these groups experience is a fear of not being able to be themselves, to cope, and it's our jobs as therapists to provide an environment where we could help them navigate their lives, work through the trauma, provide them with different treatment modalities and treatment approaches, because there are many. And I have a couple of websites that I found to be very helpful, and I'd like to share them with you, if you will. One of them is SAMHSA. Another factor that I like to speak about in working with children, adults with trauma, is attempting to come from a different type of treatment approach, which is meeting them where they're at and talking about their strengths and gathering their strengths and finding out how they work through or building on the strengths that they have. Instead of just focusing on the bad things that happen, and it's not to negate trauma, but just to elicit some of their input so that they can better feel a part of their recovery and a part of their connection to the therapist.
What do you do in a case when a child is reluctant to talk, where you need to draw him out, where he feels more comfortable with silence?
Sure. So a real effective model is to get down on their level. Okay, if depending on the age, if the parent is there, you elicit the parent and just get down on their level and speak with them very softly and let them know that you're here to help them and that you want to help them to feel better.
In some cases, children who have been through severe trauma will present with a very hostile affect, particularly when you try to help them. How do you reconcile that with your therapeutic approach?
Right. So in a case like that, it would be helpful to remind them that you're there to help them, that you understand the type of pain that they're going through, that you haven't been through it, but you understand that it must be really hard to be experiencing these symptoms and having gone through what they went through, and that you're absolutely there to do whatever you can to help them through the process.
With younger children, can you speak to how you might engage them through a type of play therapy to help them work out some of the difficulties that they've internalized?
Sure. There are actually quite a few treatment approaches to children and therapy. One is the clay therapy, and that is where they go in and then they talk about or they show you how they were affected by the trauma. They also show you how they would like to see, with the help of the therapist, how they would like to see their lives play out. And so by connecting with them through drawing, through reading, through clay therapy, sand therapy, these are all the ways that they're actually showing us how to help. I can't stress enough the importance of meeting the children where they're at. It will require having a rapport with the children and gaining an alliance with them so that they feel connected and so that they will allow you in to help them. It's a very scary time for them, and they've been through a very traumatic experience, and not all of them are going to be open to treatment, and there's going to be some resistance. But if they know that they can trust you, and if you get down on their level and they feel comfortable, the probability of the success of treatment is that much greater.
What are your techniques the first time you meet a patient for actually getting on their level, for establishing a rapport, whether that patient be child or adult?
Right. So what I do is, in my office, I ask them just to come in, be relaxed, talk to me about what they want to or not. That I'm here and that I want to help them, and I have some techniques that we could try or not, but that my whole focus is to help them to feel comfortable in their lives and to gain adequate coping skills so that they can be effective and get back to their lives.
What would you suggest for the frequency in a camp, for example, that you would want to see the same patient again and again?
Right. So again, it would determine the level and the severity of the trauma. I usually start by seeing clients regularly when I first see them. Sometimes, depending on the trauma, I might have to see them 3 times a week, but definitely once a week. It really depends on the amount of trauma. Also, just to add something that is very, very important is when you're working with a client is to remind them to breathe. Okay, just the count in, inhale, hold it 1, 2, 3, 5, exhale 1, 2, 3, 5. You'll be amazed at how beneficial this is to calming the client, their equilibrium system, allowing them to think. Because when you're in a heightened state of anxiety, you forget to breathe. You forget to think. You can't think. So deep breathing is really important. The counting 1, 2, 3, 4, 5. Inhale 1, 2, 3, 4, 5. Exhale 1, 2, 3, 4, 5. Another thing is to ask client to get grounded. Where are your feet? Get rooted in the earth. All right. Notice where your feet are at. Also, when clients are in a heightened state of anxiety, they're not aware of their time, space, reality. Ground them. Help them to get grounded by asking them to look where their feet are and being grounded to the earth. That's just another technique that I found really, really helpful. And on that note, I want to just add that, if allowed, some clients feel good being supported by, a holding of hands or, just having that type of support from either if a family member is part of the treatment, because sometimes family therapy is very effective, or a therapist, just to, a pat on the back that everything is going to be okay. I'm here with you. We'll get through this. Have been proven to be very effective. Again, my name is Lori Gayle. Thank you very much for your time. And if you have any questions, you can contact me through MCRA. Thank you.